Welcome everyone. I, Dr. Garima Sharma, with my co-host Dr. Nupur, on behalf of Delhi Homeopathic Medical Association, welcomes you all to this webinar. And this is to inform one and all that Delhi Homeopathic Medical Association was established in 1932 by Dr. Yudhvir Singh. Dr. Yudhvir Singh, sir, was the first health minister of Delhi. Nehru Homeopathic Medical College and Hospital was also founded by him, along with Delhi Public Library and NHMC. He found many other associations of homeopathy. He was the first chairman of Delhi Homeopathic Board, and DHMA has been working for the welfare of homeopathy since 1932 by various means, such as organizing health camps, seminars, national conferences, CMEs, and CME is held in Delhi Public Library on last Sunday of the month. Webinar series we started during COVID, and more than 235 webinars have been organized during COVID times. Webinar series is being continued till date. Webinars are organized every second Sunday of the month, 9 p.m. exclusively for DHM members, which are free for them. So I also would like to introduce you to DHMA membership. You all can log into www.dhma.in and avail for the membership, annual memberships. So now I request our president to address, to welcome our speaker, Dr. Shweta ma'am. Okay, so I request Dr. Deepak, our General Secretary, to welcome sir.
सभी लोगों को नमस्कार और डॉक्टर एच एल स्वामी सर, आपका बहुत बहुत स्वागत है हमारे इस वेबिनार सीरीज में। वेबिनार हम क्योंकि कोविड के टाइम से ही वेबिनार का एक चलन शुरू हुआ और दिल्ली होम्योपैथिक मेडिकल एसोसिएशन सबसे पहली एसोसिएशन रही जिसने लॉकडाउन के दूसरे दिन से ही वेबिनार शुरू कर दिए थे और पूरे कोविड में लगातार वेबिनार्स किए। बहुत सारे लोगों से हमने कनेक्ट किया और हमने होम्योपैथिक प्रचार प्रसार के लिए आज भी दिल्ली होम्योपैथिक मेडिकल एसोसिएशन लगातार काम करती रहती है। आज के वेबिनार के लिए सभी लोगों का स्वागत है और डॉक्टर एच एल स्वामी सर का बहुत बहुत धन्यवाद कि उन्होंने हमारा एक इनविटेशन एक्सेप्ट किया। डॉक्टर श्वेता भी किसी वजह से ज्वाइन नहीं कर पा रही, जैसे ही ज्वाइन करेंगी तो वो बात करेंगी, जो हमारी प्रेसिडेंट हैं एसोसिएशन की। और डॉक्टर गरिमा शर्मा और डॉक्टर नूपुर आज इस वेबिनार को होस्ट कर रहे हैं। तो डॉक्टर गरिमा शर्मा, आप प्लीज कंटिन्यू करिए।
So we are honored to have you here, sir, Professor Dr. H.L. Swami. Here's a brief introduction about sir, जो लोग आज सर से पहली बार मिल रहे हैं. He's a founder and director of Faculty of National Institute of Clinical Excellence, Homeopathy, Chairman of Karnataka, Qualified Homeopathic Doctor Association, former principal of Anuradha Homeopathic Medical College, Bengaluru, former guest faculty at Government Homeopathic Medical College and Hospital, Bengaluru, professor at Bhagwan Budh Homeopathic Medical College, Bengaluru, resource person for National Health Mission, Government of Karnataka and Government of Pondicherry, presented several scientific sessions, scientific papers in various national and international homeopathic conferences and seminars, published several articles in national and international homeopathic journals. Sir, we are honored to welcome you here and we are very eager to learn from you. And there's an instruction for the listeners. Please ask your questions at the end and you can write your question in the chat box as well. All the questions will be answered in the end. So now I seek permission from my seniors to so that we can start with the webinar.
Yes, sure. Please, sir.
Sir,
thank you, Deepak ji. Thank you, Garima ji. And I thank all DHM, Delhi Homeopathic Medical Association members, executive members, office bearers, and all the homeopathic doctors. Before that, I'll congratulate all the mothers for this International Mother's Day. Okay, you are all wonderful people. So very nice to see a lot of mothers here today. So congratulations and wishes, Mother Day wishes from me. Okay. Today, we will learn something about the upper respiratory tract diseases. In that, I will try to explore the rare and uncommon remedies. Rare, rarely used. Uncommon, common remedies which uncommonly used. Okay, common remedies which uncommonly used, and some rare remedies. Okay, so that is what the meaning of rare and uncommon remedies. Okay. Next slide. See, you all know respiratory system is divided into upper and lower respiratory tract. This I need not to go very detailed for these things. Okay, this is a picturesque representation. Upper respiratory tract consists of nasal cavity, pharynx, and larynx. Okay, next slide. What is the significance? What is the significance of upper respiratory tract infections or upper respiratory tract diseases? It is one of the most common conditions. Okay, according to statistics of 1923, so in US, 64% of the OP patients are from this category. Okay, almost 2/3 of the OP patients belongs to this condition, and each and every one of us may suffer in our lifetime 1 or 2 times at least once about with our upper respiratory diseases. Okay, next. But it is more oftenly seen in children and old ages. Okay, and especially the metros like Delhi, Bangalore, Chennai, Kolkata, we are seeing more in the metro cities. Okay, next. These basic things I'm going little fast. Okay, if at all wherever you are not followed, just let me know. The causes, as you all know, it may be infections or non-infectious is allergic. Infection may be the viral, bacterial, or fungal. More commonly viral infections, and fungus is more rare. Allergic is again one of the most common cause for the upper respiratory tract infections, especially allergic caused through either inhalation, ingestion, or contact. So in out of that, inhalation is more common, contact and ingestion is little less. Next. Signs and symptoms. So commonly, these upper respiratory tract infection people present either one or multiples of this, either with a cold, runny nose, coryza, sneezing, cough, sore throat, nasal obstruction, or nasal congestion. These are the commonly patient come to us, either sardi, zukam, khasi, gale mein kich-kich, naak band. These are the common signs and symptoms of the upper respiratory tract infection. Sometimes it may with fever or malaise. Okay? Next. If it is not treated, it may lead to the infections like sinusitis, ear infection, bronchitis. The common cold or upper respiratory tract infections, if it is not taken care in time, infection may pass on to the sinus, or it may pass on to the ear, or it may go down to the bronchitis. Okay, these are the common infection complications of the upper respiratory tract infection. Management. In the management, non-medical management is rest. Most of you know during the flu, always we advise the rest, proper rest and proper diet, fluid diet, liquid diet, avoid exposure to extreme climates, and intake of fluids. We encourage intake of fluids, especially the fresh and warm food, fresh and warm drinks is more advisable. Warm coverings also required. Okay. Next. These are all in brief about the upper respiratory tract infection. Why? What is the role of homeopathy when we are treating the upper respiratory tract infection? Majority of the time, upper respiratory tract diseases are due to either viral or allergy. In both cases, conventional treatment has very limited resources. If it is a bacterial infection, they can treat better with an antibiotic. When it comes to the viral or allergic, their hands are tight. So they have very limited resources. Okay. Next. So in homeopathic management, so as with the most of the other diseases, most of these illnesses are acute exacerbation of the chronic disease. These upper respiratory tract infection, most commonly it may be 𝑠ORA or tubercular miasm, belongs to 𝑠ORA and tubercular miasm. Rarely psychotic, and very rarely it may be syphilitic. More oftenly, patient being it's an acute condition, acute disease, either we see the 𝑠ORA, latent 𝑠ORA or tubercular is more commonly seen in these are the miasm we oftenly see. Okay. Next. So when we are talking of uncommon remedies or rare remedies, we should know what is common. So common remedies, which are the common remedies?
Aconite,
Arsenic, aconite, these are all common. Why it is called common remedy? Antium tart. Okay. Because we oftenly use these medicines, that's why it is commonly used. Okay. Once you started using the so-called non-common remedies or rare remedies, then that remedy also become common to that condition. Okay. So for that, generally I say this word, what mind does not know, eye cannot see. Next slide. What mind doesn't know, eye cannot see, isn't it? Even though if it is these remedies, information is there in your regular books like Boric, Clark, Allen's keynote, we may not be seeing that because our mind, we are not exposed to it. Okay. So that is the reason. Once we know that one, we see the efficacy of that drug in our practice, that remedy will be common for those conditions. Okay. Today we'll try to explore those possibilities. Okay. Next slide. See, information is everywhere. Okay. Today, it is not like our era where 35 years back when I was studying in BHMS. So getting a tip from our seniors is like getting a treasure. Information was so distinct. Today, information at your fingertips. Anything and everything, you ask Google Guru, it will give the information. So information is become common, but information itself is not the knowledge. To become information to knowledge, you should apply it. And through the experience, your knowledge will be well connected. There is a rationale you can see with your knowledge. And using a knowledge with the creativity makes it the gem, makes it is a good gem. Okay, then it become an art. Otherwise, homeopathy is a science. When you practice with your skills, knowledge, and experience, then that is an art. When it become an art only, you can see the miracles. You got it? Next slide. So I call rare remedies also children of lesser God. Children of lesser God. Okay? Because all children are equal in the eyes of God. Just because some are not recognized, we call it as a children of lesser God. Okay, next slide. Now we will see the rare and uncommon remedies in upper respiratory tract diseases on basis of according to the location, like nose, throat. In throat, pharynx, larynx in accordingly. First, we'll start with the nose. What is the commonest condition we see with the nose in our practice? What is the common complaint?
Sneezing,
Nasal discharge,
Sneezing,
watering of nose,
nasal blockage,
nasal blockage, running of nose. Okay? So we will start with the
Running
𝗏𝗏.
nose.
Huh?
Running nose.
Running nose. Runny nose. So runny nose is also called it as a 𝗏𝗏. In our medical knowledge, it's a 𝗏𝗏. Yes. Next. No, one by one. Achha. You know 𝗏𝗏. Next. Only in noon, the patient will be good. Neha, I will tell to show the drug. Okay. Let us know how many people know about this one. Okay. From here, go slowly. This introduction part I wanted because just only to come to the topic. So 𝗏𝗏 seen only in the noon. Okay. So already you know the drug. It is 𝐶𝑖𝑛𝑎. See, they start leaking the nose, runny nose, neither in the morning nor in the evening. When they go to school, only complaint from the school. Your child nose always leaking. You got it? Even though 𝐶𝑖𝑛𝑎 is a common remedy, but rarely you think of 𝐶𝑖𝑛𝑎 for cold, 𝗏𝗏, runny nose, isn't it? How many ever thought of 𝐶𝑖𝑛𝑎? 𝐶𝑖𝑛𝑎 means we only think of
worm manifestation.
worms,
Home manifestation.
isn't it? Okay. Next. Achha. 𝗏𝗏 when exposed to snow. 𝗏𝗏 when you are exposed to snow.
Hypericum.
Hypericum. Who told hypericum? Arey, kya baat hai?
Sir, Nishi.
Nishi. Very
Yes.
good. Very good. Hypericum, especially when you are exposed to that morning dew. That is hypericum. Morning dew is there, no? For that, you are exposed, your complaints cold after exposing to dew is hypericum. Exposing to snow is rustox. You all know rustox catch the cold from? Rustox catch the cold from?
Cold and damp weather.
Damp weather.
Bathing.
It catch the cold from feet. Rustox catch the cold from feet. Which is the
Sir,
drug? Uncovering feet. Uncovering feet exposed to the cold and damp weather. It catches cold very oftenly from the feet is rustox. If they catches cold from the head, uncovered head.
Calcaria force.
Aconite, sir.
Aconite wind.
Hipasol.
No.
Eppersul, sir, Eppersul.
Huh? Which drug?
Sorinum, sir.
Sorinum. Okay. Sorinum covers the fur cap even in the summer. That's why sorinum. Somebody put arsenic.
Silesia.
No.
Arsenic.
No. Arsenic. No. Belladonna. That's why belladonna is more indicated after exposing to rain. Complaints after exposure to rain, because belladonna catches cold frequently from head, whereas from the feet, rustox and 𝗏𝗏. 𝗏𝗏 leads more into the diarrhea type of conditions, whereas rustox lead into more of 𝗏𝗏 type of condition. Which is a drug which takes cold from chest? When they expose.
Stannum metal.
Huh?
Stannum metallicum.
Stannum metal.
Kaliars.
China, no.
Kaliars.
Calcarea, no. Huh?
Kaliars.
No.
Phosphorus.
Crania, no.
Phosphorus.
Huh?
Phosphorus.
Very good. Phosphorus. Sakshi, very good. Phosphorus. phosphorus catch cold when they go in a cold air without the jacket or without a covering the chest. They have the helmet, they have the shoes, but they don't go and export to the snow air or the cold air. Phosphorus. Beautiful. You all know the materia medica. Only thing is, I am telling about the practical application of it. If it is the exposed to dry cold, next slide. Only one slide. Exposed to dry cold.
Aconite, sir.
Aconite.
Aconite, okay. Dry wind, sharp wind, breeze also. Aconite. Dry cold, apart from aconite. Aconite is a common remedy. You all know.
What do you mean dry cold? Dry cold means without coryza?
Coryza due to dry cold. Yes, yes.
Okay.
Coryza due to exposure to dry cold. Not dry coryza. I'm not talking dry.
Parcel.
Arsal. Okay. Better remedy?
Q-Parcel.
Heparsal. Aconite, arsenicol, heparsal is commonly used in cold. I want something rare.
Gelsemium, sir.
No.
Okay.
Anybody can try?
Calcareous.
Calcareous. No.
Rhynia. Rhyonia.
Bryonia. Okay. No. Bryonia is for dry cold, not exposed. See, bryonia is the cold weather followed by wet or the cold day, cold nights, hot days. Hot days followed by cold nights.
Days are hot.
Days followed by cold nights are bryonia. Next slide.
Okay.
How many are expected this drug?
No.
No, sir.
Hyoscyamus. We never think, no, hyoscyamus for cold, coryza. And all these things I am not talking on air. All these things you can go and refer Kent repertory or any repertory based on Kent. You will get it. Like complete repertory, Kent repertory. Okay. This is not, I am just hypothecation. Everything you see in repertory. That's why I told we cannot see what our mind doesn't know. Our eyes cannot see. So one more condition. Next slide. Better by cold water bath.
Cold water bath.
Cold
Arsenic.
water bath.
Arsenic.
Better by warmth, madam. Madam, who is talking this? Isn't it? Arsenic is always better by rust will cause, no? Better. Her cold or his cold will be better if they take cold water bath.
So calcareous sulf.
Wow, super. Arey, taale bajao. Who is this?
So Dr. Pooja Khattor.
Yeah, Pooja ji, bilkul sahi hai. 100% right. Next slide.
Thank you.
It is calcarea sulf. Beautiful. See, otherwise calcarea sulf you never think, no?
Yes.
We use calcarea car commonly for cold. Calcarea fast we use, not calcarea sulf. Okay. Next slide. Only one click. Tell me, after haircut.
Sir, bromium.
Gelsemium.
Belladonna, sir.
Gelsemium.
Belladonna. Belladonna.
Belladonna, super.
Gelsemium.
Apart from that, apart from belladonna,
Gelsemium.
Naxvomica.
no. Naxvomica. Who told Naxvomica?
So me, Pooja.
Pooja. Naxvomica, right. Naxvomica. Naxvomica is there. Generally, no, we don't think, no, Naxvomica, we always think it's only for the stomach complaints. It's a beautiful remedy for the cold. Acute condition, acute cold, flu, fever, also very beautiful remedy.
Sir, what about
Naxvomica.
carboanimalis?
In the coming one, I will even show Naxvomica for the, even for the fever also. Naxvomica, very good.
Sir, what about
Next slide.
carboanimalis?
Sir, somebody is asking question.
Huh?
Can we take? Somebody is asking questions.
Yeah. I did not get that question.
Sir, what about carbo animalis?
Carbo animalis. Carbo animalis generally cold due to closed. After a long time, you are opening a cupboard or opening a car. That car, the what you call apposaries, the smell or old cloth smell. That is beautiful for carbo animalis. You got it? So some people are there when they are going in a car with a closed windows, AC, that smell, they will get cold, headache. Carbo animalis is a beautiful remedy. So after haircut, it is belladonna, 𝗏 and sepia. Sepia is a chronic cough, 𝗏. Okay. Next. Discharge from alternating side. One side right, one side left.
Leg can.
Right. Again left. Not right to left.
Leg caninum.
Leg caninum.
Okay. Anybody else can try? If it is start with right and goes to left.
Can.
Cold start with coryza start with right, then goes to left.
Most left is lachesis.
Lycopodium.
Right, goes to
left is lycopodium. Start with start with right, go to left is lycopodium. Start with the left, going to right. Lachesis. And alternating is a lacaninum.
Just opposite.
Lacaninum. Okay, beautiful. Next. Coryza in cold room. Coryza in cold room. AC, cold room.
AC, cold aggravation.
No, cold, not aggravation. In cold room only it comes. Even though cold is outside, like a cold breeze, they will not get. Pulsatilla better by open air. I agree. Which is the remedy which is they get coryza cold only in cold room.
So Dr. Varun is saying
Deepak is 100% right. Carbolic acid. I think you are Deepak, you are seeing the repertory. Calcarea fas also. Exactly. Carbo animalis and calcarea fas. I request all
carbolic
of you.
acid. Carbolic acid also you said? Sir.
Yes. Carbolic acid and calcarea fas.
Okay.
Next slide. See, I request all of you, don't open repertory now. I want to know how much on spot you can answer. Okay? Coryza due to cold water.
Cold water.
After drinking cold water, cold coming, arsenic everybody knows.
Bellis pernis in a hot day. Bellis pernis.
Yes. Hot day, yes. Any other remedy? Bellis per. Other remedy?
Heparsol.
Heparsol. Okay. It's more with a cold breeze, cold air. Anything cold it may cause, but more with the air. Okay, I take it. Okay. Any other remedy? Something rare, like Bellispar, something rare. Bellispar, I will explain there, this thing afterwards. But any other remedy? Next slide.
Oh.
Fluoric acid. How many of you know? Fluoric acid actually basically hot remedy.
Okay.
It is a hot patient. Even though they have the hot dimension, the chilly dimension is coryza due to cold water. You got it? No single remedy is totally hot or totally cold. They have the hot remedies have the cold dimension, cold remedies will have the hot dimension. And this is the best example for fluoric acid. Otherwise, fluoric acid and silica almost similar. Silica is a chilly patient, fluoric acid is a hot patient. Even though in hot patient, aggravation from cold water. Next. I think this very commonly you get in your clinics, patient. Coryza due to flowers. When they smell the flower.
Allium cepa.
Allium cepa, wonderful. Allium cepa. Nux-vomica is sensitive to strong odor, but
Strong
not
odor.
coryza.
Sir, what about
Okay.
sanguinaria?
Sanguinaria, good. Who told?
Sir, Dr. Samali.
Dr. Samari, very beautiful. Sanguinaria. Sanguinaria nitrica. There are two sanguinarias, Sanguinaria canadensis, Canadia nitrica. Okay. So, allium cepa, Sanguinaria nitrica. Then, there is one more beautiful remedy for coryza.
So, Sabadilla.
When phosphorus is
Sabadilla.
smelled.
Kya baat hai?
Phosphorus.
Sabadilla. Who told this?
Sir, Dr. Deepti.
Dr. Ragi.
Deepti.
Dr. Deepti. Beautiful Dr. Deepti. I will tell you one thing in your practice. I mean, if at all, if you can, this one. Whenever you think of arsenic or whenever you think of allium cepa, always try to rule out the Sabadilla. We oftenly use arsenic in the place of Sabadilla, where Sabadilla would have worked better.
Yes.
Okay, just think. Okay, it's allowed thinking because arsenic is proving is so good, it's so well proved. We oftenly attempt to give it, and unfortunately or fortunately, results also so good with arsenic. I don't know how many will agree with me. I call arsenic is homeopathic steroid.
Yes, sir, I agree with you.
Arsenic is homeopathic steroid. जब
Yes, sir.
कुछ दवाई नहीं काम करते arsenic दे दो. When you don't
Yes.
know, you give arsenic. At least at that time, one time it will act.
Right, sir.
Okay? Okay.
Yes, sir.
Next. Coryza are cold before menses, cold with hoarseness, cold with cough. But both it is before menses. Ammonium carb. Okay. Ammonium carb. Usually ammonium carb hoarseness is little less seen. Okay.
In place of ammonium carb is in place of no.
Sir, graphitis.
Yes, sir.
Very good.
Graphitis.
Graphitis. Wonderful. If you are seeing the repertory, please don't close it. If you are not seeing, Arey mera tali bajao. Wonderful. That is the right remedy. It is coryza before menses or cold before menses, cold, cough and hoarseness. Okay? Before menses is graphitis. One more drug which is little near to that, but usually with vomiting, with nausea is Veratrum. Okay? Otherwise,
Veratrum.
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 Veratrum all. Veratrum.
Okay.
Next. Okay? Otherwise, it is a graphitis. Cold due to suppressed menses. Menses आने की जगह में सर्दी आता है. वो टाइम एग्जैक्टली सर मेरा डेट था, पीरियड्स नहीं आया है, मगर नाक बह रहा है. Which is the remedy? 𝗏𝗏 vicarious menses, but not for this. But I appreciate your common sense. The way so many times it helps in homeopathic practice. But not in
Yeah.
No, not sepia.
Calcaria, sir.
No. Next.
Pulsatilla.
Huh?
Pulsatilla.
Not pulsatilla. No. Pulsatilla is also one of the beautiful drugs for the suppressed menses. It is, I am telling the coryza or cold due to suppressed menses. Okay, next slide. It is Senega. Senega. So rare, no? Rare remedy. But it's wonderful remedy, I will tell you. Next. Cold due to sitting on cold stone. Coryza, cold due to sitting on cold stone.
Sir, Nux vomica.
Array, beautiful. 𝑛ux vomica. I treated one wonderful flu case of homeopathic student in the hostel. She suddenly had the flu, cold, high fever. So they called from the hostel. Warden called and asked. I told what happened. They told, no, sir. They went on and sat in the terrace and this thing, that stone, which was in Bangalore in the winter season, you know, it's very cold. And that is the remedy. Even the one I told no before also, I will tell you one more example of 𝑛ux vomica. It's a wonderful 𝑛ux vomica. Very good, very good. You are all right. You are all beautiful. Good. Next. Coryza with sleeplessness. Cold with sleeplessness.
Arsenic.
Arsenic, yes, little bit I can agree. In arsenic, it is due to the dry cold. Sleeplessness more oftenly with a dry cold than wet cold.
The 𝐾𝐫𝐴ℎ also is there.
𝐾𝐫𝐴ℏ, very good. It is arsenic, not arsenic all. It is 𝐾𝐫𝐴ℏ. Beautiful. Next slide. Cold coming in only in spring.
The
Spring season.
gelphemium.
Why? क्या बात है? Very good. 𝐿𝐶. 𝐿𝐶, you all know, 𝐿𝐶 is one of the beautiful remedy for spring season. 𝐿𝐶. Apart from 𝐿𝐶, 𝐿𝐶 I will take. Exactly. Wonderful. There is another 2 remedies are there. At least I expect 1 remedy from you.
Allium Sipa, sir.
Allium Sipa.
No.
The Brinia.
No. It is lachesis.
Oh.
Lachesis and naja. I was expecting at least lachesis from you. Naja may not be so this thing, but naja is also a wonderful remedy for cold during the spring season. I am trying to pick the remedies which is either should be uncommon or very oftenly used, even if it's a common. Okay? Next. This is very peculiar, no? Only when passing the stool, along with passing in the rectum, there is pass in the nose also. The water runs from the nose. Cold. Running. Huh?
So ammonium carb.
No. Only during stools.
Thuja.
Good. I will not go. Don't worry. मैं जाता नहीं हूँ. That remedy is thuja. Good. Very good. Next. See, these are the very rare one. But if it comes, it strikes in such a way, you will never forget in your whole life. I seen the case. I seen the one case where it was so peculiar. He was telling, sir, I feel ashamed to tell this one. I'll get cold only when I go to the loop, when I go to the bathroom. Only when I'm passing motion I'll get. And so totally got out of the problem. And he has lot of allergic conditions, and also not only just the cold, he had lot of allergic condition. All that is got cleared with that one indication, which is rare. PQRS type of indication. Okay. Which is a summer cold?
That means hot.
So 𝐿𝐶.
𝐿𝐶. Good. It is both for spring and summer. Very good. Good. Correct. Next. Cold will aggravate when you are talking. जब भी बात करते हैं, वो समय में ही आता है. I was very fine, sir. Moment I picked the phone, when I picked the conversation, it start leaking.
So belladonna.
You try. Little
Sir,
better than
sternum
that.
metallicum. Sternum metallicum.
No, not sternum.
Sir, causticum.
Bryonia.
No.
Sir, causticum.
Causticum. No, sir.
जी हाँ.
Huh?
The 𝐾𝐫𝐴
No.
Natrum carb.
No.
Sir, aconite.
Aconite. Good, good, good. Who told? Aconite.
Lachesis.
So, Dr. Khyati.
No.
Lachesis.
Lachesis will never get aggravated from talking. They will be enjoying. Others who are listening will get aggravated. Aconite. Good, 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 good. Okay, very good. Next. Dry cold weather. Dry cold weather, not wet cold.
Aconite.
Aconite. Aconite. Okay. Apart from that,
Nux vomica.
Nux vomica. Good. Nux vomica. Next. Next slide. Windy weather.
Aconite.
Okay. Aconite. What type of wind?
Wind. Monk.
No, there is a word
Northeastern.
in our
Northeastern. Allen's. Keynote symptom.
Dry cold wind.
Dry cold.
Windy
Okay.
weather is the euphrasia.
Euphrasia. Very good. Euphrasia. Euphrasia. Who told?
Dr. Niharika Jain.
Dr. Niharika Jain. You just differentiate the euphrasia with the 𝐴𝐿𝑖um-𝐶𝐴.
Euphrasia with 𝐴𝐿ium-𝐶𝐴.
Okay. I will give you one table. Very easy to
Sure, sir.
remember. If there is coryza or the discharge from the nose is acrid, from the eye, 𝐴𝐿ium-𝐶𝐴.
Nose, eyes.
Eyes is sore.
Euphrasia.
Nose is bland.
Euphrasia. Eyes also watery eyes. Nose,
Both are watery eyes. But the euphrasia, that watery eyes is sore or the acrid.
Excoriating.
Okay. Whereas nasal discharge is bland. Reverse is 𝐴𝐿ium-𝐶𝐴.
Yes, sir.
Both eyes and nose discharge is sore or acrid. Then
Euphrasia.
no. Euphrasia eye, not the nose. Nose is bland.
Sir, for both arsenic.
Arsenicum. Arsenicum also.
Very good. If both are bland,
𝐴𝐿ium-𝐶𝐴.
no. 𝐴𝐿ium-𝐶𝐴, nasal discharge is acrid.
Dysphoria.
No,
So
no diaspora.
pulsatilla.
Pulsatilla. Beautiful. Pulsatilla.
Pulsatilla.
See, very easy, no? Remember, nose, eyes, nose, eyes, acrid, bland, bland, acrid. Both are acrid, both are bland. So, majority of your cold symptoms you can treat like this. Okay? Next slide. Postnasal. So, because this is we will just, I will give some. Hello?
𝐾𝐫𝐴.
𝐾𝐫𝐴 is one of the beautiful remedy. And apart from that, I am giving some indications of some remedy, like Corallium rubrum. Okay. In Corallium rubrum, it is excessive secretion, inodorous mucus, profuse secretion through postnares, and obliged to hawk frequently. They try to bring it out. Okay. That is Corallium rubrum. Okay. Next. 𝐾𝐫𝐴. Somebody is asking. Postnasal 𝐾𝐫𝐴 is one of the beautiful remedy. Where in 𝐾𝐫𝐴 indication is it is stringy, sticky. Okay, it doesn't come out easily. When Corallium rubrum, it is more profuse. In 𝐾𝐫𝐴, less profuse. Next, another one of the beautiful remedy for postnasal dripping is the
Lemna minor.
Lemna minora. Lemna minora also one of the beautiful, where In lamina minora, it is more offensive with loss of smell. Loss of smell. It was very, very useful in my clinic during COVID time. Lot of patients used to come after post-COVID. They came out of all symptoms except the smell. So we, along with that, if they had the post-nasal dripping, lamina minora helped. Next remedy. Next, this one is from nose is epistaxis. Which are the remedies you know for epistaxis?
Phosphorus.
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 Folium,
Millefolium.
ammonium carb.
Ammonium carb, phosphorus, millefolium.
Brania,
Yes.
sir. Brania. Brania.
Bryonia, okay.
Arnica.
Arnica,
Hamamelis.
Hamamelis,
Brania.
okay. Hamamelis also, but in Hamamelis it should be it's a passive.
Millefolium. Millefolium.
Tellurium, good, tellurium. You tell me the indication, tellurium. Tellurium, good.
All bleeding remedies. Lacasis.
All bleeders also, good.
Protalus horridus.
But arnica stands very
Arnica.
fast if it is because of the
Hamamelis.
injury. Okay. Next slide. Somebody can read.
Yes, sir, I can read.
Yeah.
Ammonium carb, bleeding from nose while washing the face in the morning.
Okay. Next.
Hamamelis, blood is of dark color. Phosphorus, frequent and profuse bleeding, hemorrhagic diathesis. Crocus, dark stringy blood. Arum triphylium, constant picking of nose until it bleeds. Bovista, early morning bleeding, confusion in head.
Okay. Next slide. Any doubt? See, here I mixed the common like arnica, hamamelis, ammonium carb, and I gave something rare like crocus, sativa, and aurum triphylinum. Bovista, it's one of the beautiful remedy. Very oftenly we will not think of Bovista. Okay.
Millefolium.
Millefolium, sir. Next.
Millefolium.
Digital is also good. Next slide. Adenoids, tell me. No, 1 minute. Go back. Which are the remedies? Adenoids.
Agraphis.
You saw it. You tell me, Agraphis, what is the indication?
Calcarea.
Calcarea, which calcarea?
Calcarea.
Calcarea.
Calcarea sulf. Calcarea sulfa, pasa.
Sulf.
Calcarea phos.
Curious bin also is there. Calcarea phos also is there.
Calcarea phos.
Calcarea carb is also there. Okay.
Calcarea carb.
Agraphis, somebody told. What is the
Agraphis
indication?
mutans.
When you give Agraphis?
Sir, the child sleeps with mouth open.
Okay. There is
Due
one
to the
very
adenoids,
peculiar and very strong character symptom in Agraphis, cold or Agraphis adenoids. Tell me that.
the adenoids are there in the neck. They are so profuse that they won't let the air pass.
Okay. There is very rare one symptom is there, sir.
Tonsils will be enlarged. Tonsils will be enlarged along with the adenoids. You can feel it. It is so big that you can feel it. It is so big that you can feel it.
Okay. There is one more indication.
And they get
Hearing loss. With hearing loss. Hearing
Yes,
will be reduced.
there will be a hearing
Child
loss
will
in
hear
Agraphis.
less in school. Teachers will complain. Lack of attention. Child is not listening. Adenoids, tonsillitis, especially adenoids, along with hearing reduce, Agraphis nutus is one of the beautiful remedy. Yes. Read, ma. Next. Read.
Excellent remedy for adenoids when hearing reduced due to this. Calcarea falls in children, especially in thin, weak, pale face, child peevish and obstinate. Hydresis canadensis, almost specific for adenoids, used externally also. Mucous membrane is yellow and excessive enlargement is there.
One of our colleague used to use Hydresis canadensis as a external application, as a wash. They used to give. Okay, we diluted Hydresis to wash the nose. So what you gelneti type. Okay, okay. So it's also one of the beautiful medicine even for internal also, not only external. Next, yes, read, ma.
Cystus canadensis, scrofulous swelling and suppuration of glands of throat.
Cystus canadensis is also one of the beautiful remedy. Even it is used for cancerous conditions, but it's for the adenoids also one of the beautiful medicine. Next.
Teucrium, especially in children.
You all missed it. One of the beautiful medicine for the nose block,
yes,
especially in children, along with worm infestation. This is almost specific. Okay.
Yes.
Sir, I had a doubt about this adenoids. I had a patient, a small child, and she was recovering for cold and cough with calcarea falls. And the mother was only complaining that her cold and cough is better, everything is better, but the child is opening her mouth and sleeping at night. And there is a nose block, so she went to the ENT and found out there is adenoids. So in this case, do you refer to take Agraphis nutans? Do you suggest to give Agraphis because of the opening of
Agraphis
mouth?
is only one of the remedy. As I told you, if it is along with the, you ask the parents, did they observe any change in their hearing?
Okay.
If it is there, Agraphis. Otherwise, you start with Teucrium. See, you treated that child with calcarea or which one? What you told?
Calcarea falls, I had treated her.
Calcarea falls.
Calcarea
falls children, calcarea and Teucrium relationship is very beautiful. Even in my clinic, what I will do usually after Teucrium, if it is repeating, I usually give calcarea car. And which case.
So in this case, Teucrium, I can give 3 doses.
Teucrium. If there is no other this thing,
yeah.
Otherwise, any other indication is there, you can give it. Okay? Teucrium, especially for children, it acts wonderfully, at least for that moment. It may recur. Teucrium, one of the problem is it recurs. Okay? It will not end the case. But it gives the relief, wonderful relief. At least the parents will be happy. It has to be followed by some deep acting remedy like calcarea carb, silica, tuberculum, like that of remedies, that type of remedies. Usually, most of the tubercular remedies helps for the Teucrium. Okay?
Okay, sir.
Good. Next. Nasal polyps. Which are the remedies?
Lemna minor.
Lemna minora.
Teucrium verum.
Teucrium.
Calcarea carb.
Calcarea carb.
Calibicrom.
Calibike, wonderful. Calibike. Allium sipa, okay. Allium sipa also, along with this one. The Coryza. Okay, okay. So we'll add a small list which is clinically verified. Okay. Next, yeah, you tell me. Lemna minora. If it is right-sided Teucrium, left-sided, okay. Left-sided alumina. Alumina. Right-sided Teucrium, left-sided alumina. One more drug is Sanguinaria canadensis with headache, sick headache. Kali nitric also. So alumina is beautiful remedy. Very oftenly we miss this remedy. Alumina, we not think on the nasal condition.
Sir, alumina and alumina, there is difference, no?
Alumen is different, alumina is different. This is
but
alumen.
It is written Here in your typing it
Alumen.
is written alumin.
Alumen. Okay. Not alumina, metal. Alumen. Okay.
Alumin.
So tuja, you can think as a
Tuja.
different remedy, anti-miasmatic remedy, deep acting remedy, where sinusitis with loss of smell, thick green discharge, like our pulsatilla type, that type of cases you can think of the tuja. So with this we will end. Okay. Any doubts? Because 10 o'clock, sir, is it time up?
No, sir. For study, there is no time limit for us. If you want to continue, please
Sir, I
continue.
can continue for another 2 hours.
Yes, I know. Because I know this is a starting of the engine. You are running up. So
Because
this is
next I finish the nose. Now next, if I want to take, I have to take the pharynx and larynx or the throat part. So just that's why I told, because how much time we have. Otherwise, best thing is I will spend some time with the question answers. So that will be better.
Seems like we have to do a webinar series with you. Each day one organ.
Thank you, ma. Thank you.
Thank
Any
you so
questions
much,
are there? Somebody asked 𝐶𝑜RIZA during eating. Who asked? I just saw it.
Sir, that is a very common, means many patients have been complaining of this.
Yeah. So
No, they will actually get that particle into the throat, and that will cause 𝐶𝑜RIZA.
𝐶𝑜RIZA. So according to our metromedical repertory, 𝑛Å is more indicated, especially 𝐶ORIZA or cold during eating or after eating.
Okay.
Okay. One more remedy is 𝐾𝐫𝐴 erecta. I don't know how many you know it. 𝐾𝐫𝐴. It's a beautiful remedy, skin remedy. Okay. But that also you can think whenever the 𝐶ORIZA while eating.
Okay.
Okay.
𝐾𝐫𝐴.
One more rare remedy. It is sanicula. Sanicula. You use sanicula
for constipation. For constipation. Small children
with constipation. Cold 𝐶ORIZA with constipated child. Inconstipated child. Beautiful remedy. Okay. And one more Indian remedy is there. Anybody? One Indian remedy is there. For 𝐶ORIZA while eating. This all we are talking while eating. Aggravation.
Carbo-veg.
Carbo-veg is Indian remedy?
Sir?
I told it's a one Indian remedy. Indian drug. Indian remedy
means herbal.
Huh?
Herb.
No, Indian. See, you in the Boric there is list of drugs called as Indian remedies. Indian drugs. It is food in India.
Ocean sanctum.
Ocean sanctum. Acha. No. Ocean sanctum is also good remedy for 𝐶ORIZA, not for while eating. Which is the queen of fruit?
Magnifera indica.
Mango.
Magnifera indica. Beautiful remedy, Indian remedy for 𝐶ORIZA while eating.
Should I stop the sharing this slide?
But it's only 1 mark distance. Referred. It gives only 1 mark. Now I referred.
Acha, you referred, huh? So I used, madam. Which repertory it is there? Which repertory?
Clinical proving they will add.
Clinical repertory, huh?
No. Clinically, it has to be used for so many people. Then they will add to 3 marks, 4 marks.
Acha. No. In which repertory you got this information?
As you complete repertory, sir.
Complete.
Just
repertory.
now I referred. Just now after you told I referred.
Okay. So
Should I
it
stop
is
the
an
sharing?
Indian remedy, beautiful remedy. Okay. Okay,
Should
you
I
can stop sharing
Okay,
because see, almost we are in the middle. It will take one more at least session for that. As Dr. Garima is telling, will if at all, if the time permits and everything goes well, so again we will see. We will take up at that time.
For sure, sir. Thank you so much. So now I request seniors from association to enlighten with their views, their learnings for the session. Our patron, Dr. V.P. Singh, sir.
There is one question from Dr. Deepika Balani. Question 1, sir, when Dr. Kent mentioned only sanguinaria, then it is which one, can or night?
See, that is nothing like that one. Usually it has to be clear because we oftenly use both, but commonly whenever there is only sanguinaria, if it comes to the repertory part, it is canadensis, unless otherwise mentioned as nitrica. Okay, but very entirely different picture presentation is there from sanguinaria nitrica and sanguinaria canadensis. So always it is better to mention either sanguinaria C or N.
Okay, thank you, sir. Second, kindly cover some remedies on sore throat due to sore food, please.
Sore throat, huh? Madam, there was again few slides are there on sore throat. Okay, so sore throat is a condition. Again, it's on so many indications are also there. So as Dr. Garima told, if it will sometime we will again at that time I can tell. But because sore throat itself is a throat one, a lot of remedies are there. Okay.
Okay. Thank you, sir. Another question from Dr. Aparna Soni. How can we use hydrostasis externally in adenoids?
That's what I told. In my clinic, I never use it. I never used it. But in some clinics, I see one of my colleague, junior, in his clinic, I use hydrostasis internally, not externally. What he does is, in allopathic medical store, there is a nasal drops called without medicine. It is called normal saline. Normal saline, no?
Nasoclear.
Yes, sir, nasoclear.
Nasoclear something.
Normal saline.
Where there is no medicines, only saline and preservative they put. Usually what he does is, he asks the patient to bring it and mix hydrostasis canadensis either in low potency or mother tincture, few drops, and ask the patient to, parents or patient to tell them, shake it and use, put 5-10 drops.
Nasal spray.
Spray, no, drops. Okay, that's what they are using. I'm just telling. So again, you have to do it clinically, verify it. It's not my personal view, but it is used. I know it as that is used. Okay?
Maybe the congestion will decrease, sir.
Congestion will decrease. It helps for this thing. See, instead of using allopathic drops, see, it is a common sense. It's common sense. Instead of advocating, some people are insisting, no, sir, give some drops. But in my clinic, what I tell them is, I ask the patient to boil the water. For example, 100 ml of water, boil for 5 minutes. Put small pinch of salt, less than 1 pinch salt. See that after it comes back to room temperature, then you can use it as a normal saline to rinse your nose. Okay, so you can use along with some homeopathic medicine like hydrostasis or tucrium also. Clear?
Yes, sir. Thank you. Another question from Jyoti Tonk. Which remedy can be used coryza after applying cosmetic?
After applying cosmetic, after applying cosmetic, skin will be there. I don't know, coryza, you can take it as a strong smell. Which are the remedies for strong smell? Coryza with strong smell. Allium cepa, Nexamica, phosphorus. You can think. If it is a skin complaints.
Bovista.
You are all very intelligent here.
Even Viola water internal.
Next.
That's it.
That's all?
Yeah,
That's all. Dr. Garima, over to you.
Yeah, thank you, Dr. Nupur, for asking all the questions. Now I request our seniors to highlight their point of view, their opinion on the session. Our patron, Dr. V.P. Singh, sir.
I think Dr. V.P. Singh sir has left.
Sir, you can share your views. Dr. V.P. Singh sir is there.
Okay. Dr. V.P. Singh sir.
सर जी
जी सर, अपने व्यूज प्रेजेंट करिए सर आज के सेशन के रिगार्डिंग।
एक्चुअली डॉक्टर साहब लेक्चर इतना बढ़िया रहा क्योंकि अक्सर हो जाता है और हम इसको एक्यूट समझते हैं, ये बड़ा क्रोनिक भी रूप ले लेता है। इवन पेशेंट के साथ में जब पेशेंट को होता है तो हम लोगों को भी ये एक तरह से हो जाता है, तो हम लोग खुद परेशान हो जाते हैं। तो मैंने भी इसमें एक्चुअली डॉक्टर साहब ने जैसे बताया कि आर्सेनिक वर्क जस्ट लाइक स्टेरॉइड, आर्सेनिक आफ्टर दैट ब्रायनिया बहुत अच्छा काम किया, जो कि आज डॉक्टर साहब ने बहुत ही बड़ा डिटेल में हम लोगों को समझाया है। इट इज वेरी नॉलेजफुल एंड बहुत ही अच्छा लेक्चर डॉक्टर साहब का रहा है, जिससे हमको बहुत अच्छा, हमको खुद को भी और पेशेंट को ठीक करने में बड़ी मदद मिलती है। बहुत अच्छा रहा डॉक्टर साहब।
Thank you, sir. Thank you very much.
Thank you so much, sir. और हमारे पास we have many messages in the chat box to continue this session, to continue the series. So, sir, we'll be looking forward to you.
Thank you, thank you,
Thank you, sir.
thank you. Very nice meeting all of you. All wonderful people. Very nice. It was a. I did not know how 1 hour went.
Same here, we also. So, I request now it's time for presenting the certificate. So, I request Dr. Deepak to present certificate to sir.
डॉक्टर श्वेता भी हैं। डॉक्टर गरिमा एक बार देख लीजिए भी।
I request our President, Dr. Shweta Singh ma'am, to highlight their points. Shweta ma'am? No, sir, I can't see her.
Okay. डॉक्टर गरिमा, सबका सर्टिफिकेट है आपके पास?
Yes, sir. Sir shared already. Many congratulate. So for this
सर ये
session.
हमारे पूरी टीम की तरफ से है, और जैसा सेशन आपका रहा है बस ऐसे टीचर्स ही हमें चाहिए। और बेसिकली होम्योपैथी जिंदा सिर्फ सिम्टोमेटोलॉजी पर है। अगर आपने सिम्टम्स उसके कैच किए, जैसे F4 नंबर 3 में डॉक्टर हेनीमैन सर लिखते हैं, इफ द फिजिशियन क्लियरली परसीव्स, मतलब अगर फिजिशियन ने वो क्लियरली परसीव कर लिया सिम्टम, तो होम्योपैथी से बढ़िया पूरी दुनिया में कोई भी पैथी है नहीं। क्योंकि हमारे यहाँ पे सिम्टम का जो इतना मैचिंग है और जितना इंडिकेटेड मेडिसिन है, सिंगल मेडिसिन है, वो पूरे किसी भी मेडिकल सिस्टम में दुनिया में कहीं भी नहीं है। और इतना वंडरफुली एक्सप्लेन और इतना जल्दी से, मतलब 1 घंटे के अंदर मुझे लगता है कि मैक्सिमम जितने भी मेडिसिन हैं वो सब कवर की सर ने। तो बहुत अच्छे सिम्टम्स और एक्सप्लेनेशन के साथ हम सर जरूर चाहेंगे कि आप कोई ऐसा सेशन लें ताकि हम लोग कंटिन्यू इसको सीखते रहें लगातार। डॉक्टर एनसी चटर्जी हैं सर, अबोहर से, जो राजस्थान में है। उन्होंने हमारे साथ कोविड के दौरान लगभग 1 हफ्ते तक लगातार सेशन लिए, और उन्होंने ऑर्गन के बारे में इतनी अच्छी बातें बताई। वो मतलब जब शुरू होते थे तो हमें रात को 12-12 1-1 भी बज गया था उनके सेशन के साथ। हम लोग 9 बजे शुरू करते थे और 3-4 घंटे तक। तो आज मुझे वही स्पीड आप में दिखाई दी। मतलब मुझे लगता है 1 घंटे में तो आप सिर्फ कहते हैं ना कि वार्म अप हो रहे हैं। अगर आपकी स्पीड पकड़ेंगे तो हम 3-4 घंटे में तो आपकी स्पीड फुल उस पे होगी, स्विंग पे। तो आगे के लिए सर जरूर आपसे आशा करेंगे कि आप हमसे कनेक्टेड रहें। थैंक यू सर।
If they want, if any further queries or they want this one, please note down my mobile number. It is 94480 33325. and my email ID is drhlswamy@gmail.com. Okay. So apart from, you can contact the DHM this one, and apart from that, if you have any queries or any further this thing, you can contact. Thank you, sir. Thank you very much.
Thank you. Thank you so
I
much.
request you, Dr. Swami, please repeat again our CME, any CME.
Okay, sir.
Dr. 𝐾𝐫,
Yes, sir.
please tell us about our CME and other activities.
Okay, so we have our webinars on every second Sunday of the month, say Sunday, 9 p.m. only, and every last Sunday we have physical CME in Delhi Public Library, 3 p.m. onwards. So I request all the homeopaths, all the present doctors here to attend, and you all can log into our website www.dhma.in and look for the memberships suitable to you, and so that you can have access to free of cost to all our webinars and other activities organized by DHMA. So now I request.
One more thing, सर हमारी एसोसिएशन से एक जर्नल भी पब्लिश होता है जो एक पीयर रिव्यूड जर्नल है, 1932 से चला रहा है, द हैनिमैनियन होम्योपैथिक संदेश के नाम से। ये हम बाई एनुअली पब्लिश कर रहे हैं। अगर इसमें किसी को भी कोई अपना आर्टिकल, ओरिजिनल आर्टिकल सेंड करना है तो हमारी वेबसाइट पे जाएंगे dhma.in पर, वहाँ पर सबमिट योर आर्टिकल में क्लिक करेंगे और अपना आर्टिकल सबमिट करिए। तो ये भी हम लोग एक छोटा सा पहल कर रहे हैं सर। 1932 से जर्नल चला रहा है, बीच में कुछ समय के लिए बंद हो गया था, लेकिन 2020 में हमारी टीम ने फिर से एक बार रिवाइव किया है। तो प्लीज अगर कोई भी अपना आर्टिकल भेजना चाहें तो प्लीज वेबसाइट पे जा करके सबमिट कर सकते हैं। थैंक यू डॉक्टर गरिमा।
Thank you, sir. Sir, I request you to give the vote of thanks in this session.
थैंक यू। सो डॉक्टर स्वामी सर, बहुत बहुत धन्यवाद आपका। जितने भी लोग यहाँ पर ज्वाइन कर रहे हैं, DHMA के साथ हैं, सभी लोगों का बहुत बहुत धन्यवाद। डॉक्टर गरिमा, डॉक्टर नुपुर ने बहुत अच्छे से वेबिनार को कंडक्ट किया। डॉक्टर साक्षी गुप्ता, डॉक्टर ऋचा, डॉक्टर वीपी सिंह, डॉक्टर SP वर्मा सर, डॉक्टर वाई सिंह सर, डॉक्टर रजनीश, डॉक्टर भटनागर, जो हमारे एग्जीक्यूटिव टीम है, वो लगातार DHMA को आगे बढ़ाने के लिए काम कर रहे हैं। मैं रिक्वेस्ट करता हूं कि अगर आप सब लोग भी DHMA ज्वाइन करना चाहते हैं तो dhma.in पर जाएं और वहाँ पे मेंबरशिप के सब्सक्रिप्शन है, वहाँ आप लॉग इन कर सकते हैं। या हमें 9711423617 पर कॉल या व्हाट्सएप कर सकते हैं, या हमें ईमेल लिख सकते हैं dhmadelhi@gmail.com पर। तो थैंक यू सो मच, सभी लोगों का बहुत बहुत धन्यवाद। और अब हम मीटिंग एंड करते हैं इस आशा के साथ कि हम दोबारा से जल्दी मिलेंगे डॉक्टर स्वामी सर से। थैंक यू।
Thank you so much.
Shubhratri, sir. Shubhratri.
Good night, everyone.
Thank you, sir.
Thank you.